CEO, plan president for Arizona Complete Health, Complete Care Plan. So if you're not familiar with us, we cover the central region as a traditional sort of Medicaid ACC plan, and in the southern region, we have both the ACC and REBA contracts. And then our sister company is Care First in the north, who also has the ACC and REBA population in the north. So very nice to meet all of you. And I'm actually a native Arizonan.
Okay.
And I'm an ally.
Oh, thank you, James. So
Absolutely.
Next is Dan Haley, and some of you guys from out of state have never gotten to really meet Dan, but he has made great strides in your lives. So this is the great Dan Haley.
Well, I don't know if I'm great, but I am Dan Haley. I'm a peer, family member, and ally. And I also happen to be the CEO of Hope Incorporated, which is a statewide peer and family-run organization.
Thank you, and you'll hear more. Okay, Tammy?
Oh, give me just 1 second.
Okay, we'll go ahead and go to Troy.
I'm on a Zoom meeting.
Where'd you go, Troy?
I'm here,
sorry.
Kathy.
Where?
I'm sorry, it's not till 11:15 and I'm on this important group Zoom meeting. I'm
You could
sorry.
mute if you're not speaking, please. Thank you.
Okay, go ahead, Troy.
Hi, I'm Troy Grover. I'm the forensic program manager for Hope Lives.
And you're a peer.
And I'm also a peer.
The most important piece.
Yes,
Okay.
I am a peer, yes.
And Tammy, oh, there you are. Okay, go ahead, Tammy. You're on mute. Tammy, you're on mute. There you go.
Okay, is that better?
Yeah.
Okay, I'm so sorry, I'm at work and my next customer came an hour early. And so I had to go to the door and tell her I had it all locked. I said, I'm on a Zoom call. You're not for an hour. So I'm sorry. It was just bad timing for that.
Oh, sorry.
So anyways, yeah, my name is Tammy Smith and I am a parent of a recovering addict.
Okay, so these are your panel members. And at this point, I'll turn it over to Lori and Christina.
Okay, thank you, Kathy. And again, on behalf of NAMI Yavapai and the Northern Arizona Peer and Family Coalition, welcome everyone. Thank you to the panelists and for the audience for attending. Our topic today is success, defined and discussed. So we're going to have the panel discuss what success is, what does it look like, how does it differ from that of a provider or a health plan, and we will have discussion with the audience. Last month we had a discussion about the successes and the gaps. Well, it was pretty much about what's good and what's bad with the system, where are the gaps and problems. So this time we came back to kind of follow up on that with people who have experience from both sides or one or the other of working in the system and receiving services or having family members involved to see, what is success? What does it take? What does it look like? And how do we define it? So I'd like to introduce our panelists first. James Stover is the Medicaid president for Arizona Complete Health, Complete Care Plan, a Centene company. James has 25 years of Medicaid managed care experience. He serves as the CEO of the University of Arizona Health Plan, Banner University Family Care, prior to joining AZ Arizona Complete Health in 2017. James is responsible for the health care of over 400,000 Medicaid and Medicare dual and eligible members, including those members with serious mental illness and crisis services in Southern Arizona. James has expertise in the full range of managed care, including network management, contracting, operations, and compliance. And I'll tell you, James, when I see that number 400,000, that's quite a bit there. James holds a Bachelor's of Science in Business Management from the U of A and a Master of Arts in Organizational Management from the University of Phoenix. He is a native Arizonan from Ajo, moving to Tucson pre-high school. He serves on the board of directors for Sun Corridor, a Tucson economic development organization, Special Olympics of Arizona, and the Arizona Association of Health Plans. So being an avid traveler, visiting 6 continents and over 50 countries, we're glad, James, that you can take this time to be here with us today. Dan Haley has served as CEO for Hope Incorporated since April 2010. He's worked with the behavioral health and criminal justice systems of Southern Arizona his entire career, striving to bridge the two systems through his work at Hope and previously with the Regional Behavioral Health Authority as a criminal justice specialist. Hope provides peer support services in 8 counties throughout Southern and Northern Arizona. As a peer living with mental illness and substance use disorder, Dan knows firsthand the power of peer and family involvement. Thank you, Dan, for being here. Troy Grover. Troy has been with Hope Lives for 4 years and has been a forensic program manager at the Flagstaff office for 3 years. Troy has lived experience with substance use and the criminal justice systems. He served 5 years in prison for 7 felonies and has been in recovery for over 4.5 years from drugs and alcohol. At Hope Lives, he has served in mental health courts, in 2 superior courts, and 4 municipal courts. Troy is currently, well, I guess since you wrote this, you have moved now. It says currently moving, but you have relocated to Mojave County in the Kingman area, where Hope Lives now has offices in Kingman, Bullhead City, and Lake Havasu. You'll be working in 9 treatment courts. So that's really, the need has been, well, that's a void that is now being filled. We're so glad to see you up there. So Troy also will be starting a pre-adjudication diversion program in Mojave County. So much needed. Kathy Basher is a staunch advocate of peer and family-driven care in the behavioral health system. Her can-do spirit has resulted in the strengthening of peer family voice, access to care and choice and services throughout the system. Kathy recently retired from Access as the Bureau Chief of the Office of Individual and Family Affairs, fondly called OIFA, where she built the program to one that is recognized throughout Arizona's Medicaid program. She has served on various boards, including Mental Health America of Arizona and NAMI Valley of the Sun. Now in retirement, and I have to kind of laugh when I see that word for Kathy because she's working full time with all the stuff she does. Now in retirement, she is working more than ever. She's president of the Arizona Peer and Family Coalition, serves on the board for NAMI Arizona, and is the president of NAMI Yavapai. Thank you, Kathy, for being here today also. Tammy Smith is, we're so glad to have Tammy here, and Tammy is going to introduce herself.
All right. My name is Tammy Smith. I'm a mother of a recovering addict, and I have been married 31 years. I have 5 children and 7 grandchildren and 2 more on the way. And my oldest daughter is the only one in my family that's had an addiction problem to drugs. So when that became apparent, it was a very difficult thing to go through. I took her, I got, guardianship of her children during that time. And the family has just pulled together and tried to support her through her recovery. And she's now been in recovery for over a year. And doing great, I might add.
Thank you, Tammy. So Christina, you're going to MC this, the panel, and I'll help lead with questions from the audience. And with that, Christina, you want to kick this into gear?
All right, yes, perfect. And thank you all again for being here. I'm really excited for this panel dynamic that we have going on here today. I can't think of some better folks to be on the panel with us. And James, I feel like you have the toughest seat being the CEO of a health plan. But I also want to mention something about James is he's, you know, he understands what it's like to be a peer and have that lived experience. He's been such an ally for members throughout the years. So I feel like there's not a better CEO to be on this panel with us today. So thanks for being here, James. And I'm really hoping that we can all walk away with a greater understanding of what success looks like from our respective chairs, because it's different, right? But there's also some similarities there. So thank you all for being here. And Troy, as Kathy mentioned, you did such a dynamic job last month that we had to have you back. And Troy's actually going to be presenting in one of my social work classes coming up here soon, because I need them to hear from him as well. So thank you all for being here. So with that, I want to start out with the big question of the day is, what does success look like from your respected chair? And whoever wants to jump in first can.
I'll go ahead, Christina.
Go ahead, Kathy.
And I'm going to start because I'm very anxious, and most people don't know. I live up in the wilderness, off the grid. My closest neighbor is over a mile. And the reason I do this is because I get inundated with noise, and I get overwhelmed. So when I was working at Access, one of my biggest successes was getting off the elevator, walking down the hall, and the hall would start going like this. I would get to my door that I had to use a card, and I'd actually be looking at the doorknob. And it was actually at waist high, but I was looking up at it. I would go into my office, and it would take me in half an hour to calm down to get so I could even function. And so to me, every day I did this, and it was terrifying to me. And I don't know where that came from. I thought if I keep doing it, it'll go away. It never went away. And that was kind of how I started my day. And then I would have to go for lunches. And I would almost pass out. I would sit there with people and eat lunch, and I didn't know if I could swallow it, if I could talk with people. The anxiety was really overwhelming. But I think the hardest thing that I have experienced, and I'm very proud of myself, because for me, success is being in society and being able to open doors for other people. That is what I get a great deal of satisfaction for. And I have to endure these things in order to get there. So one of the hardest things that I've had to endure is stigma, because it puts you into a situation where, especially if you have a label, if you respond in any way to that stigma, it attaches to your label. And so you have to figure out a way to respond so you don't dig your hole deeper. And I've done this with my family and with society. You have to, and many of us learn this, every day we're exposed and criticized and blamed. And to me, that I am extremely proud, and I feel that my biggest success has really been, I feel like I have some courage to experience that and keep in front of me my values of including other people, integrity, because a lot of times we don't even look like we have integrity when we have all this coming at us. So my anxiety now is building. It's time to kind of toss it over to someone else to share. But I hope this is what you were wanting, Christina. It's just I get up every day, and I just not every day. There are days that I stay in bed, but you guys don't know about it.
Thank you, Kathy. Thanks for sharing that. And let's just go in order, and we'll go Kathy, Troy, then we'll head over to Tammy as a family member, Dan to the provider, and James as a health plan. So Troy, would you like to chime in next? What does success look like to you from your respective chair?
Yeah, thanks, Christina. So success to me looks like a psychological safety in our communities. And what I mean by that is, until it's safe to have a mental illness, until it's safe to be a justice involved person, until it's safe to have a substance use disorder, we're not going to recover. Recovery happens in a safe place. Like, a person needs to be able to say, this is what's going on with me. right? So a psychologically safe environment. And that's what success looks like for me. So I tend to think comprehensively at the community. One of the reasons that I'm still in recovery is because I accepted that I was an addict, and I accepted my history. I mean, 7 felonies, and I gotta tell you, I was not framed. So I committed all those 7 felonies, and then so for the rest of my life, I'm a felon, right? Like I have, that's what my life is like. Just recently, I moved to Kingman, and I rented a house, and I have a beautiful new house, and I'm so glad that I'm not paying Flagstaff prices anymore. But one of the things that I did was I had to apply for that house. Remax was managing the property, so I walked into the office and I asked them to tour the property. I came back, and they gave me, when you tour a property, they give you a list of requirements. And they also list the things that can exclude you from being a potential renter. And on that list is criminal history, credit score, eviction, all of which I'm just like, yeah, all of those. I got all of those because, I was an addict I've been in recovery for about 4.5 years, but prior to that, I was not in recovery. And I have all the lived experience that goes with that. So I walked in there, and the Troy today has the confidence to say, I deserve this house. Like, I'm a good person. Like, you're going to rent to me. And they did. Remax was awesome. I just told them, I was like, hey, I got history. And they said, okay. And they were just wonderful. The Troy from 3 years ago that was moving out of 4 years ago, moving out of my parents' house for the first time in forever long, would not have even applied. I wouldn't have even applied for the house because I was afraid, for fear of the rejection, right? So part of my recovery and part of my service to the community is I talk about and share my lived experience with the justice system and with recovery all day, every day. I'm used to it. I was at Optimum on Saturday hooking up cable to my house, and I was joking with the people in the store about being in recovery, and it was funny. We were talking about, now I work in recovery, and it's working out for me. Having a job is good for my mental health. Having a house is good for my mental health. Having Wi-Fi so that I can do my homework for ASU is good for my mental health. Right? It supports my recovery. One of the things that I've become aware of is that in our communities, many of us get our permissions for how we treat other people from the government. In other words, if the government discriminates against you, then it's okay to discriminate against you. So if the government says you do not have the right to vote because of your criminal justice system involvement, and they also have the right to punish you, then that kind of sets the permissions for the general public. They also believe that they also have a right to discriminate, and they also have a perceived right to punish you for your mental illness. And the good news is that I think that a lot of that is changing. The evidence to support that that's changing is that I walked into Remax and said, yeah, I have criminal history and I'm in recovery. And they're like, okay, here's a house. And it was not a problem. So there is evidence to support that changing. I think it's also worth noting that, we used to discriminate against minorities. Discrimination still exists. We used to not allow women to vote. And we used to think that that was okay, right? Because the government says, hey, women, you don't count. You don't get a voice. Now they do that to justice-involved people. Like, you do not get to vote. We take your rights away from you. Essentially, you're no longer as human as a citizen who does not have a mental illness. the evidence of the mental illness being substance use disorder and the resulting justice system involvement. So I think that bringing awareness to like authoritarian perspectives on that, government perspective on the justice system, I mean, I think that is, I think that's worth looking at. I think it's worth talking about, because people are generally good people. We really are. Like, it's not like we discriminate because, you know, we're evil beings. Like, we're kind of socially conditioned to discriminate. Like, if the government, which for many people is their higher power, I mean, certainly it is a higher power to me because the state of Arizona is bigger than Troy Grover. You know, let's bring awareness to that like, it's discrimination. It is discrimination. We justify it and we say, well, this is just the way it's always been. Felons, they give up their rights, right? Like, that's justifiable. Let's discriminate because of this reason. Well, we used to discriminate based on color. We used to discriminate based on sex. We still discriminate based on sex and color, right? So that's okay. Just like it's okay to be an addict. It's okay to have a mental illness, right? Just accept it. And then we can move forward from there. So in short, my idea of success looks like a community where it is safe to be an addict. It is safe to be a felon. Like, again, I would not have I live in a beautiful neighborhood. I live in a beautiful house. It's new. It still has the new house smell. I love that. And that's because today, like, I believe today that that's what I'm worth. Like, I'm worthy of that. Like, I deserve that. The Troy from 3 or 4 years ago would not have even applied, I'm telling you, because of the fear of rejection. So if that's the way I feel, I talk about justice system involvement and substance use disorder all day, every day. I'm used to it, right? I'm no longer afraid of that. Most people don't have that benefit. Most of our people in recovery, unless you work for Hope Lives or Dan Haley or a few other, places, there's no safe place to be an addict. Likewise, I'm so glad that Tammy agreed to come on, because Tammy's daughter, Kim, is a rock star, just so you know. She was our first staff hired in Mojave County, and she is awesome. And I appreciate that Tammy's willing to come on and share her experience, because for every person in addiction, every person in recovery and involved with the justice system, they have family. None of us go through this alone. For every person that's in the justice system or in recovery, there are just the affected group of people is huge. Children, parents, friends, family, loved ones, like the whole community is involved with this. So thank you, Tammy, for being there. And with that, I will just restate that. Psychological safety. Until it is safe to be an addict, until it is safe to be a felon, until they can move on from that, until we stop discriminating against them and saying, when we take away a person's right to vote, what we're really saying is you don't matter and you don't get a say in it. It's not that we're like legitimately afraid that the felons are going to get together and change public policy. Like, that's not going to happen. That's not a legitimate fear, a rational fear. What it does is it legitimizes dehumanizing people. And as long as that's the system, then that's what we're up against. So to me, psychological safety, let go of stigma, give a chance for people and families to recover. Thank you.
So Troy, can I just ask you one follow-up question?
Yeah.
How did you mentioned the Troy from 3 or 4 years ago? How did the Troy from 3 or 4 years ago get to the Troy that you are today?
So by working at Hope Lives. So honestly, Hope Lives was the first place in my life where I was allowed to be a felon and have a job. Okay, so I can have like a steady job, like a place to go every day, and it was safe to be me. It's the first place that it was okay to be a felon. It's okay to be an addict. It's okay to be insecure and feel desperate. It's okay to like be, so at the time I was like, what? So I'm 48 now, so it's probably like 44. Like I just felt like such a loser. I'm like, I started at Hope Lives and it was like $13 an hour. I was just like, you know what I mean? Like it was, I don't know, but because I had a safe place, because that was my job, was I started confronting it in court. So one of the first things they did was I served in court. And so being on the help side, being on the solution side of the problem, being invited in by the court was so meaningful and so healing and transforming. You know, because I was like, oh, I didn't know that this community existed. I didn't know that it was possible. I didn't know about recovery. So really having that community, being able to talk about it, and also being invited in to be a part of the solution. The court, judges, attorneys, and that's the way like my life is today. Like, you know, we're part of the solution. We're part of the team. We're embraced, and that gives a person meaning, hope. That's what makes the change. You know, before that, I did not know how to talk about recovery. I certainly not with my family. Okay, like even to this day, almost like we just don't. There's certain things we just don't talk about because it's not healthy.
Sure. And I wanted to highlight that, Troy, because I think that's, you know, it's fascinating how far you've come in the last 3 to 4 years. And it's important to remember how we got to that point, right? I'm hearing job, I'm hearing specialty provider, right? Being with the peer and family supports, being empowered, having that view of success, recovery is really important. So thank you for sharing that, Troy. I'm going to move over to Tammy. Tammy, from your chair, what does success look like for you, your and your family?
Well, basically, like Troy, some of the things that Troy said really resonates with me because there is such a stigma attached to people who are going through addictions. And typically what happens is like family pulls away from the addict pulls away from family. And as much as, you know, we told my daughter how much we cared about her, we could not see it firsthand. It was too difficult to see it firsthand. And the only way that I knew to help her was to take care of her kids. She was in an abusive relationship, so that I feel like kind of was a trickle effect. You know, the relationship started her into the drugs, and then she lost her kids because of the drugs, and then she got even more into the drugs. And so what I honestly, with her recovery, which actually started through a drug conviction, she got a drug charge, and because she'd never had a drug charge before, she qualified for a program called the Quality of Life program. And for the first time ever, she was treated not like just an addict, but with respect by the judge, by his clerk. And that actually started her on a better path. She wanted recovery. She didn't know exactly how to get it. But with that, she knew that at least she was going to get an opportunity to not spend time in jail if she could, you know, do their program. She had some setbacks because it's not easy in recovery, unless, you know, even in some cases, people go to rehab and they still backslide. So she needed a lot of mental health therapy. That was part of what she needed because she was still in this abusive relationship, even though she was going through Quality of Life. So after about 4 months and a possibility, because she tested, you know, positive for drugs a couple times, she was facing jail time. And she finally, you know, made that realization that she needed help. The problem is, a lot of people on drugs don't know how to ask for help. Their minds aren't even clearly able to speak what they need because of the drugs. And so she was literally aimlessly wandering around town, showing up at various relatives' houses for like 3 days in the summer heat. And like, she was obviously crying out for help, but no one knew how to help her, because like my husband always said, you can't help someone unless they are ready for help. And that was part of the problem. I always wanted to help her, but I don't think she was ever ready for help. But when she started doing that, I'm like, this is becoming a mental health issue, and she doesn't know how to ask for help. And so, and this is the sad thing, my husband's sister is a nurse practitioner at a mental health facility here, and her husband is a case manager. And you have to say such specific words to get any kind of help and treatment. And people that are involved in drugs don't know what words to say. But thankfully, my husband was able to just go and pick up my daughter and take her to the hospital and coached her on what things she had to say to get help. Because on her own, she never would have been able to do it. And she might still not be in recovery. And she might have spent time, she might be in prison now. But because of, luckily, that involvement, which it shouldn't be that difficult. It shouldn't be that difficult for addicts to get help. But it was really, really hard. And from there, they had her in detox for a week. And then because her boyfriend kept trying to get to her, even in detox, then they sent her to Phoenix, which is like a 3-hour drive away, for rehab, because they were worried for her safety. And, and so she was only there for a month, 30 days. And she felt after 30 days, she really worked the whole rehab program. I mean, if you saw her journals, she just journaled everything. And, she felt a lot stronger after that 1 month. Looking back, I think 3 months would have really benefited her, but because the boyfriend was still an issue. And so once she got out, she came back, and she wanted to be back with her kids, obviously. So she came to stay with us. But after like 3 days, she went back to the boyfriend. And then she didn't use, and she realized after a few days that is not what she wanted. She got far enough away from it and got enough help that that's not what she wanted. So then, but I couldn't have her stay in my house and live with her kids when she still had involvement with the boyfriend. So luckily, she was able to get help from her father's family, my ex-husband's family. And she never had a relationship with her biological father. And that started her healing with that relationship. And then it really kind of snowballed, like everything started really rapidly happening after that, when she started having a relationship with him and with his family. And she moved in with his mom, and eventually she had her kids with her. And so I think, success is just, what I've experienced with it is just when, like Troy said, reduce the stigma. Don't treat people like they are terrible humans because they have a drug problem. My daughter has the biggest heart of anyone I know. And her problem was she always wanted to help people, but she started helping the wrong people. And then the wrong people took advantage of that and her goodness. And, it just really, and then she was broken down by the boyfriend. So I'm so happy to see that between quality of life and being treated with respect by the judge and clerks, that, and then she's been through a lot of mental health therapy, and she continues like on a daily. She's, you know, she's found God, goes to church. She donates time for the church. And just through all of that, like she has made it through. And I think she respects herself again. For so long, she didn't have any respect for herself. And so, you know, as her mom, like that was just heartbreaking. And but I can't even say how grateful I am for the quality of life program that we have here. And we need more. We need it to reach more people. And I don't think, because I don't think going to jail would have done anything for her. You know, it's these programs that help them steer them, you know, not to go to jail, but to try and help them in their recovery. And once she was just in a really good solid place when she decided to go and take her peer support certification, because she told me like, I want to help people. I want to help the same people that you know go through everything I've gone through. I want to help them so that they can feel like they are worthy and have value. And like Troy said, like that's the problem, is that even now, all this time later, you know, if you are a convicted felon, like you never seem to get a break from that, you know, so you just hope to prove yourself over time, you know, but the stigma attached to it is just, it's really sad. And there is a huge drug problem in my area in Kingman. And I just hope, you know, with Hope Lives, that the more people are aware of the services, that the more people can be helped.
Great. Thanks, Tammy. And where are you located?
I'm in
Where was-
Kingman.
And is that where the quality of care or the quality of life program that your daughter
Yeah.
participated in was?
It's
Awesome.
It's through the Justice Court here in Kingman.
Awesome. Thank you for sharing that, Tammy, and thank you for being here today. And it's really exciting to hear how much success your daughter has found and you have found as a family. So thank you for sharing. Dan, I will turn it over to you. What does success look like to you from a provider standpoint?
First of all, I just need to let James know I also am a native Arizona. I was born in Yuma and lived in Ajo actually, and have siblings that graduated from there. Success for me is the fact that I'm here talking with you all. I've been clean and sober for 31 years. First diagnosed with mental health issues at the age of 9 after my first suicide attempt. And, you know, hid my mental health for many, many years, which led me, I think, to substance use, and did that for a while. And with the threat of losing my children, I decided that I needed to do something to better my life for them initially, thinking that's what I was there for. And I got into this great world of 12-step and recovery. I had an old sponsor that told me, if you spend half of your time that you're out there gunning and running and focus on recovery, you can be successful. And he goes, you need to decide what success is for you. And be careful with ego. Don't let ego get involved, because you start feeling good, things start happening. And, you know, because ego's also what kept you out there using. And I had to think about that for a while, but what he said was accurate. For me, getting up every morning and still being sober one day at a time is my success. Some of the benefit of my success, though, has been brought to this field and be able to work with people with mind light. When I was out there using, the only friends I had was the people I used with or the dope dealer. And after I got clean and sober, I had nobody except for the 12-step community. So for me, I talk about this with my children. who, knock on wood today, do not have a substance abuse background or history. They do have mental health, and we've worked with them throughout the years, and their stigma is really reduced for them because they openly talk about what their journey has been. And I think that as a person in recovery and being taught to share my story so that others may get from it was really a really strong indicator for me that I just needed to do what I needed to do for me, and other people may benefit from that. And I think I've seen that over the years. And then become an employer of folks. I was thinking about your story, Troy. We're going through this process right now where we're going to be co-locating in the jail and in the courts, and in our job descriptions, we're saying felony required. We're saying that lived experience of being behind bars required. And I think that has brought me the greatest feeling of success, is being able to help reduce some of that from 5, 10, 15 years ago, when we weren't allowed to even be in the same room with folks that have that lived experience. So for me, the success is every day. Being thankful for what I have, and being thankful for who I happen to have the opportunity to be hanging out with for the day, like you all, and watching folks work their program recovery, and I'm there to assist versus telling them what to do. I was that person who, anybody tried to tell me what to do, I ignored them. I was not going to do that. I was going to probably do the opposite. So again, I learned in my recovery journey is that just live by example, what that truly means. I mean, recovery for me has been probably one of the hardest things that I've had to do. And it's funny, I still have family members, even as recently as last year, say, well, now you're over this thing, can you have a beer? I go, well, no, I can't. You just don't get it. But again, it's my job to keep educating folks, and that's what I do to help me identify what my success is.
Thank you, Dan. Follow-up question: as a provider, you've done such a great job with Hope Arizona expansion, taking on new programs, taking on more members. You've done an incredible job with the organization. As a provider, what does success look like to you?
So I have several employees. I have two in particular that I'm really kind of excited about. They both have criminal justice background, both are addicts. And one came and through a work program through the probation, was actually a receptionist for us. The other came and had community service to do, and so he was a cook in our kitchen while I did his community service. Both those young men hold management positions. They've gone and gotten their RSS, they've gone and got their forensic side, but the both of them are running statewide programs. And one of them is our SOR program, which has been very, very successful. And our other is our second responder program. That's success. Not only success, and it shows that we've given them an opportunity to be successful, but they gained success on their own.
Awesome. Thank you, Dan. All right, James, what does success look like for you?
Awesome. Thanks, everybody. And great stories. I can't believe, Dan, as long as I've known you, we've never talked about Ajo before. But so to that point, I grew up in Ajo. And so I'm going to kind of talk about my journey of success, because what I would say is that I didn't, and I'm going to be very honest right in the beginning, I worked for Banner University for 18 years, which back in the days of the physical health plans, right? So it was the acute care plans and the REBAs. So I was on the physical health side. And when I first came to the REBA Simpatico at the time, 6 years ago, I did not understand the value of Peer and Family Services on sort of the recovery model and those kinds of things. I was really fortunate to have people like Kathy at the agency at the time when I came to work, worked with Christina on a project, worked with Dan Haley, who were really good teachers for me and were really patient because I made mistakes in sort of, kind of that transition, but really helped me see the value. So I'm going to kind of start off with what success looks like and a little bit of a story related to that. But I think there's a perception that success to a health plan is making money. And honestly, that's part of it, right? So part of my responsibility is that I am, responsible for making sure that the system is stable and financially stable and can be sustainable and all of those kinds of things. So that is true. What I think, though, there's sort of a misconception is that financial outcomes are related to denial of services and people not getting care and those kinds of things, right? Really, financial sustainability is ensuring that people are getting the right levels of care and really trying to avoid higher levels of care like inpatient and those things, and totally understand that there are times when that is absolutely necessary. But a lot of times it's because you don't have the right systems in place for outpatient services or engagement with peer and family. And I'm going to talk, a little bit about sort of how I've learned that. So my journey of success actually in sort of this arena started probably 10 years ago, before I was part of the REBA system, before I really understood sort of the value that it brings. And I was helped to ask an individual who was really having some major health issues, physical health issues. So she had just turned 65. She had just retired. She was low income, both Medicare, Medicaid eligible. She had worked like as a janitor in the school systems for a long time, and then became like a para-pro tutor in the classes and those kinds of things. But when she retired, her husband was younger than her, still working. She started having, and she had some health conditions throughout her life, right? So she was diabetic and was a former smoker, so had some like respiratory issues and stuff. But generally, it was managed. But once she retired, she started having all kinds of health issues. She started having frequent urinary tract infections. She was losing cognitive ability. Like all these kinds of things started occurring all of a sudden. And at one point, she had over 200 inpatient days in a physical health hospital, 200 inpatient days. So they reached out to me. They asked me if I could sort of help this individual. And at the time, the University of Arizona actually had an integrated sort of health program that was, both physical and behavioral, et cetera. So I asked them if they could go out and sort of talk to this person. And actually what they found is, she needed some adjustment to her medicines and things like that. But the big issue was that she was depressed and lonely. So she had worked in a school, right? She'd been around kids. She had had sort of, this kind of situation, and she went to being home all day by herself and not being able to have conversations with people, not being able to, reach out to people, not being able to talk to people. When her husband got home at night, he was tired, right? Because he was a groundskeeper for the school. So he was tired and would, not really want to engage and go to bed early, and he worked really early in the morning and all those things. So she was losing cognitive ability because she didn't have anyone to talk to, and she didn't have any sort of, interaction with individuals. She was eating more poorly. She was diabetic and starting to eat poorly because she didn't really care about it. And it wasn't related to her physical health issues. It was related to her loneliness and her depression. So what happened was they got her in, I told you she was low income. They got her involved in a program with an after-school program, and she started to become more vibrant. She started to do things, and actually for the next 8 years, she had no inpatient stays. Because of that connection, they got her involved in faith-based communities, all of those kinds of things. The reason that's so important is that's actually a very true story of my mother. So that was my mom. At one point, we thought that my mom would actually never leave like rehab or inpatient facilities. So very, very, very important. But it didn't translate to me when I came over to the REBA world, sort of the power of like the people that they connected her to and those kinds of things. So what happened is I started getting involved. I started to see outcomes related on programs. So, you know, Dan Haley has been a super good partner, as well as lots of other peer and family organizations. But since Dan's on the line, I'll talk about Dan. Has had some really good outcomes with programs. The HELP program, which goes into inpatient facilities and starts to get people connected to care. All of those kinds of things have been, and I'm sorry, somebody just rang my doorbell, so you're gonna hear that in the background. But have had, you know, and what I saw, right, was that there was a reduction in inpatient visits. So forensic peer and those kinds of things. When we can get people effectively connected with peer services and family services as they're coming out of justice environments and those kinds of things, you see better outcomes. You see fewer level 1 inpatient stays. You see fewer behavioral health, residential stays. And actually you see better engagement of even things like PCP visits and those kinds of things. So it's really, really, really important. And at the end of the day, that translates to a better financial system, right? So you take my mom, for instance. My mom was probably, $1 million a year person with all of her inpatient stays, and her health wasn't good, right? It wasn't like she was getting like a good quality of care. It wasn't like her quality of life was good. Being able to connect her and engage her in those services is really what provided the success for her as a person, because she started to become, much healthier, much happier with life, all of those kinds of things. And from my vantage point, right, it also was a success because she wasn't on my plan, but if she was, right, it was a success because not only was she more engaged and healthier as a person and had a better quality of life, it was also a lot less expensive, right? It was a lot less expensive to get her outpatient services and peer and family services than all of the things that we were providing her. So I would say, again, I really, really am appreciative to people who are on this call, because I know when I started, I made some mistakes related to, the understanding, but people were really patient with me and taught me, right? They taught me the value of, peer and family services and those kinds of things. And if people wouldn't have been patient with me, I don't know that I ever would have really gotten it, right? So I really thank individuals here. And again, sort of relate back to the fact that success, from my standpoint, is both related to having better outcomes, meeting people where they are, and a lot of that has to do with engagement. And I have never worked with organizations who are better at engaging people than the peer and family community.
Awesome. Thank you, James. That's great. And so I just want to pause there for just a quick moment and see what if others want to share their definition of success. And while we have folks from the audience think about that, I just want to quickly share mine, because I have had the privilege of both being a peer family member as well as in a seat as a provider. And so as a peer, for me, it's getting out of bed, it's taking a shower, it's being available, it's being here at my meetings, it's being impactful, it's having the energy to get things done, it's having the energy to go and exercise. As a family member, my brother has been sober now for 110 days. But it's been a long journey. And for me, success as a family member looks like honesty. He's being honest with me, I know he's doing well. But again, that's my perspective as a family member. As a provider, one big success was that engagement, and then engagement led to building relationships with members, but also encounters. And in order for me as a provider to expand my reach and serve more people, I needed that engagement because I also needed those encounters. And so I sort of wanted to share now as an advocate. Success for me looks like making sure that peer and family members have a voice at all tables, whether it's the legislative process. To James' point, we spend so much time and energy thinking about solutions for a community. We have the legislator talking about building, putting billboards that talk about youth mental health without talking to the youth and figuring out what they want. And the youth were the first ones to say, we're not driving around looking at billboards, we're on TikTok. right? So we just spent hours and hours and hours, right, in legislative sessions and committee meetings talking about what youth need without really asking the youth. So for me, success now as an advocate means talking to those folks who have been in those shoes, and making sure that you know what they need and what they want. So others would like to share what success looks like. Kathy.
I just want to make a comment. There's a common theme, and that's what Troy brought up, a safe place. And, you know, and as James brought up, you know, it's reaching out, it's having community actions, it's interacting with other people. And these are kind of common themes. And when we think about the clinics, we think about the stigma that we face, you know, this just seems to be something that we have to break down in order for really people to be there and start that recovery process. And we're just not totally, especially in Northern Arizona, we're just not there yet.
Thanks, Kathy. Others from the audience want to share their definition of success?
This is Lori. I'm just going to jump in and having worked, you know, 16 years for one provider, 8 years for Peer and Family, and now a year and a half for another Peer and Family, and being involved with the coalition, chairing the Northern Arizona Peer and Family Coalition. I look at the challenges we have and the great understanding of voice and choice, and I see success as being having choice and access to care.
Great, thank you, Lori. Anyone else, or at this point, does anyone have questions for our panelists?
This is Deb J, and I'll throw myself on camera, maybe. There I am. Hi, everyone. Success is being able to connect our members and our families to the support that they need while working in the OIFA office, ensuring that the fidelity of peer support that's being provided in our state is of the highest quality and the most so that it can be the most impactful and not watered down. There's a lot of work to go around at a provider. There certainly is. And there are tons of, you know, individuals that are seeking help through our services. And when someone connects with the, you know, the peer support or the family support, there's a shift made. All of a sudden, they really are respected, and there's nothing about us without us. And success for me has been working as the OIFA, being able to move the needle and actually, you know, work with Dan Haley and community members up in Show Low to get our peers in the ED actually able to outreach those who have been identified with substance use disorder, and making sure that they are being steered to that safe place, and that they're experiencing that safe place because there are peers in the ED. When I went for help, I was told that the individual I went to, she didn't work with people like me, you know, and those are words that will turn you away for a while and could be a good while longer. ED is the emergency department. And this is really groundbreaking. We haven't had peers in emergency departments overall. It's been something that's been really, there's been a lot of pushback by hospitals, and the staff up there, I'm in monthly meetings with them, the ED staff and Dan, and it's just incredible the enthusiasm they have for this program. A second piece is that intentional peer support is being brought to Arizona through Granite mountain behavioral health. And I'm just tickled about that because it's just really the gold standard of peer support training and being of service to others. My own recovery, I just celebrated 30 years of clean time in recovery, and I'm, just blown away. How did I get this old? And success is family that has been, raised and we grew up together. Honestly, my children and myself, and they're amazing human beings, and I'm in awe. And I'm just so grateful for the opportunity to work in this field. And I'm so grateful to Kathy, who pushed me to go to go places that I was like, I'm not a corporate person, Kathy. There's just been, it always takes a village, and I'm so grateful for the mentors I've had and the friends that I have in this field. So that's my thing. Thank you.
Thank you, Deb.
Hey,
Go ahead, James.
Hey, Christine, it's James. Can I just jump in really quickly? And so I was very remiss in also when I was sort of giving my definition of success. So I'm so glad Deb is on because we work for sister organizations, so work really close together. But I was really remiss in sort of my journey of talking about the impact of the OIFA departments in the health plans. So like I said, I came from an acute care plan. At the time, they weren't integrated, so I didn't understand OIFA at all, and I certainly didn't understand the impact that had on a health plan, and really the impact that member choice and voice has in the decisions that you make as a health plan. Right, to your point, Christina, there's individuals where we make, a lot of plans and think that things are really great, and they don't impact the people because we don't talk to individuals about what really is going to impact them. I think your discussion about youth was a great example, right? So they're like, oh, so we're going to spend all this money on something that actually is going to have no benefit because it's not going to reach out to people. So I had I was very fortunate to work with Tony Smith, who I think, probably a lot of you on this call knew Tony. And he, I know is a big miss from our community and our, and our organization as well. We really, really miss that. But Tony was really, really instrumental, along with, the other individuals that I talked about on this call, in helping me understand that benefit, because I just didn't get it when I first started. And he and having the OIFA areas be integrated into your quality committees, having members be integrated into committees where we're making, decisions around how we provide care and programs that we should be looking at and implementing. It's really, really, really instrumental to the health plan to have that ability to understand what is really going to impact, because my idea of what's going to impact an individual is probably very different than somebody who's, living with, has a, living with a challenge currently. So I was remiss. I'm really glad Deb was on because it, reminded me of the importance of OIFA, and I apologize I missed it the first time, but thought it was worth jumping in just because of the importance OIFA has to actually the healthcare, health plans, and the way that we make decisions.
Awesome. Thanks, James. I appreciate that. Anyone else want to share either their definition of success or questions for the panelists?
MU, you're on mute.
MJ?
Or MJ, I'm sorry. Still can't hear you.
MJ, if you're talking to the group, if you want to unmute yourself.
Hey, can you hear me now?
Yes.
Okay. My son is in Arizona, and he was in Yavapai County Jail for most of last year and refused any kind of help. And then he got released this year, and he's been staying in a hotel. in Cottonwood, and he told me at the end of December that he wanted to spend this year working on his mental health. So I 100% supported that. And the situation is, I think he's got the good idea, but he doesn't have the momentum. And he's got assistance. He's got good assistance from his case manager and also from Hope Inc. and even his probation officer. We're going to have a Zoom call later today. And I think sometimes he's not asking them enough for what his needs are. And so I don't know how to get him more momentum so that like I would say in the course of a week, he's probably spending less than 3 hours doing something with either the support that he has or just progressing forward. So it's just kind of, we have an idea that he wants to help himself, but I don't know how to help him get further forward. That's why I'm having this call this afternoon.
Well, we've talked a couple of times, MJ. One of the things I would suggest, unfortunately, coming from you or another family member isn't going to hit as much as it is coming from another peer. So I would really, voice some of your concerns on what you think that he should be doing with his peer support staff, and they can help interpret that differently for him. I know that it took me a long time to allow my family to make suggestions, and they always made suggestions, and they were always good suggestions, but because they were coming from family, I automatically just said, well, I'm not going to do this, because they were telling they were offering, and they're just trying to be supportive. Sometimes that's just really hard for us, especially new in recovery. For me, it was difficult for me to kind of really listen to what my family member was saying and realizing it was coming from a place of love. And that's kind of hard when you're, relatively new in recovery, that listening to family members is not what we want to do. So just a suggestion.
Thank you. And I have tried to be less involved, but sometimes I've had to almost give him an ultimatum to get him to do something. And what I hold over his head is the hotel room. You go do this, and then we'll talk about renew. I mean, I didn't intend that he would be in a hotel from Christmas till today. That was going to be like a small bridge. And that's another question I have is he's been diagnosed with SMI, but he hasn't gotten all the paperwork done. And so I don't really know where we go from here. If I could write a script, I would have him, I'd ask if he could go to the program that Tammy's daughter went to, that he would get some mental health therapy, and then he could get a job working for Dan. If I could write it.
That's a really great script, MJ. I appreciate you sharing that. I love that. And so, MJ, you have a meeting with some folks today that will hopefully be helpful for you in sort of moving forward in the next steps.
Right, but a lot relies on his initiative. They're not going to go to him. He's got to be the one that asks for it. And I don't know how to get him to, I've told him that, like, you have your lifeline right now, like that game show. I said, those people are there. It's up to you. Take advantage of this opportunity. Yeah. But sometimes he doesn't.
That takes a lot of patience and strength on your part, right? And I think as Tammy had to take a 11 o'clock appointment that she had, but I think as she alluded to with her own daughter, it wasn't until her daughter was really ready to take those steps to begin down that process. I know it's not an easy answer, but the reality of the situation, right, is your child might still be in that contemplation stage and isn't ready to sort of embark in that action stage. But it sounds like, from Dan chiming in, it sounds like you have some connections and some relationships already built, and hopefully those peer supports can be very helpful to you and your family.
Yeah, thanks.
Going forward.
Ralph, you got your hand up.
Yeah, listening to MJ's story, it's just very reminiscent of the last couple of family support group meetings here on the mountain. we have a mother with a 29-year-old, and he's SMI, but he also has an addiction problem. And she's just pulling her hair out as to how to get him to get help, so to speak. So I've been listening to, this advice from peers here who are talking about their journeys. And for people like myself as a family member, or this mother as a family member, or MJ as a family member, what's the best mechanism to get them to connect with a peer that will resonate? Ask someone who owns one principal, if we could get them connected with the right kind of guidance from a person who's been there, someone like Troy. But this guy's got 3 court dates, Montana, Arizona, and California, because he gets into trouble all the time. He's on the psychosis end of SMI, and he's sometimes just totally incoherent with his actions. But I don't know how, to connect him to the right people. I don't know those people well enough. Question?
Well, Ralph, I'm assuming he's up on the mountain with you guys?
Yeah, he's living in a trailer outside his mother's house right now, I think. Last I heard, anyway. We have family sport group tomorrow. I'll hear the next chapter then.
What do you mean by the mountain? Is that Flagstaff?
Oh, I'm sorry. I'm talking White Mountains.
Okay.
Sholo area.
Okay.
So I think that's why it's so important that we have a peer run available in all areas, because MJ participated in our NAMI family support meeting. I connected her with Daryl, with Hope, and so there was someone I knew that could intervene, because, when I try to connect people to the clinics, her son would have just been lost, and he has been lost. And so now finally we have that in-between person to connect people to.
Ralph, if you want to send me some contact information for this young man, I would be more than happy to send out my outreach team to take a look at him.
Okay, I visited one of your folks over in the ER the other day, and I don't want to. It was Amber, I think.
Okay.
I went to Sean Hopper, who's running the ER, and he introduced your people. One of them was there anyway, and I don't want to interrupt anything with a personal issue like this woman's issue. I don't want to interrupt the process. I am so pleased to see these 2 people co-located in the ER, and so I don't want to impact that in any negative way with a personal issue like this, Dan.
Well,
but
I don't see it as that, and it won't be an interruption. We also have I have opiate staff up there also. So
we do.
Yeah, we have a total of 4 staff up there now. So
that might be the right kind of connection. I will have her send you the connection for the meeting tomorrow.
That'd be awesome. Okay.
Thank you.
Thanks, Ralph. And I see here in chat as well, Suzanne Bloom says, I have a son with the same SMI drug addiction in a different state, legal problems in Utah and Arizona. So as we wrap up, one, I'm hoping that we can make some connections here for folks on this call. And Suzanne, please let us know if you've been connected to someone, if you need to be connected to someone. But I just want to pick on Troy and loop back to Troy here. Troy, as an individual where you've been a son, as some of these family members are mentioning here, what would have been helpful as a family member, or what would have been helpful for you at that time when you needed the help the most? What would you say to these family members who are struggling and wanting to do better for their kids?
Yeah, thanks, Christine. That's a great question. And what it would have been was somebody with lived experience to come intervene. Like, I would have respected that. So here's the thing, like, I was an addict, I was a felon, 5 years of prison did not solve my mental illness. It did not solve my substance use disorder. it actually just added all this shame and fear and challenge on top of it. But I didn't know that there was a recovery community. I didn't know what recovery looked like. I didn't know personally anybody who was successful in recovery. I did not one soul. So to have somebody with lived experience, somebody who's successful in recovery, who's been where I've been, who's been to prison, who's an addict, to come and say, hey, I got an idea, let's try something out. That would have been beneficial.
Great. Thank you, Troy. And Suzanne, I was just getting ready to write in chat here, but welcome to Arizona. You've come to the right place. You've come to the right meeting. You found the right folks. We will help get you connected. Deb put her number in chat here for the Office of Individual and Family Affairs. Please reach out to Deb, and then we will also send you, Suzanne, if you want to put your email in the chat here, then Dan and Troy with Hope Lives can also reach out to you and see what they can do to help get you moving along here. With that being said, I am going to turn it over to Lori here shortly to wrap things up. What I want to just sort of end with is, I think at the end of the day, we all seem to agree what success looks like. And we all know and agree that success is recovery, is folks being respected, feeling safe, being given opportunities that others without mental illness and substance abuse are the same opportunities. I think that, we all need to be a little bit more aware and recognize the success factors when working with a provider or health plan, knowing that while we all want this same thing, we also need to make sure we're paying our bills and covering our bills and meeting our encounters and meeting our outcome goals and stuff. There's a lot of red tape. There's a lot that the system puts on our providers and our health plans as well. So knowing when we're advocating within those systems that they have a lot of outcomes and requirements that they need to meet as well. So with that being said, Lori, I'm going to pass it over to you to give us some updates and wrap things up.
Thank you, Christina. So we have upcoming events. The last Monday of every month at this time, we do the Mental Health Monday. We are hungry for topics, and we want topics that are of interest to you. So please let us know what topics might be of interest. And if you know of presenters to go along with that, fine, we're open to your suggestions. So the next Mental Health Monday is April 24th. The next Northern Arizona Peer and Family Coalition meeting is Wednesday, April 19th. We meet the third Wednesday of every month from 1 to 2:30 by Zoom. And you can always go to the NAMI-Yavapai.org website for future NAMI and NAPFC event times and Zoom links. We look forward to having you join us in any of those. And I will put the NAPFC email in the chat for anybody who may need that. So with that said, I just want to thank everybody again. And we do have just a few minutes. I know as a family member looking at success of a family member, patience and understanding the system and understanding how things work and how do we measure success? Is it a longer time between relapsing? That is success. We want realistic expectations, and this is where coming to support groups, coming to NAMI meetings, coming to panel meetings like this to learn from others can be very helpful. I know with a family member of mine, until they got on medication, which may not be the answer for everybody, but for this individual, it was a big piece. They didn't have the insight, and it took months for the medication and then the therapy along with that. And this was in Oregon, not anywhere that I had direct reach or that sort of thing, but I think that if we can help get the word out about the peer and family run through the clinics, and this has to do, I'm going to say something about the culture in the North that is shifting from where they were told to keep everything in-house to now expanding, and where we used to have referrals, now we don't. Someone can walk in, but they need to know about where's that door to walk in. So if we can get the flyers in the clinics to help get that word out, this is one of the things that NAPFC is working on. And we are going to have a roadshow forum in Kingman, May 24th. Is that the right date? 24th or 3rd? We'll have information coming out about that to bring providers and peers together. We're just in the beginning stages of that. So anybody else have a last minute comment? Dan?
Thank you.
I have a comment, and then to answer Suzanne, yes, there are 2 peer runs that are up in the Prescott. One is Hope Incorporated and the other is NASCARE. So there's 2 folks up in that community. The other is that I think we need to measure success in another way, especially I'm very fortunate. I work with all 3 health plans, and I'm very grateful to James and his team. It may have taken you a while to get there, but the ability to you to listen to people like Tony and to Deb, that is success, because you by far, Arizona Complete Health by far today has been the most receptive for getting people involved, members and family members getting them involved. And that's you. That's you and your team doing that. I think, there's some health plans that we still have segregated CEO meetings. And it's just like, I just don't quite get that yet, but we're going to work on them. That's what we do, is advocating and helping us. But I just wanted to say, James, if you made mistakes, I didn't see them. Only thing I ever had was the willingness. And I think the success is because you listen.
Thanks, Dan. And with that, I want to turn it over to James for one last announcement. Arizona Complete Health, as Dan has alluded to, has done a really good job of listening to peers and family members and having them being involved in the system of care. And they have a C3 planning meeting coming up. We had the opportunity to work with them, providing a civic leadership training to a lot of the members in Southern Arizona. So James, if you want to just, and I know this is mainly for Southern Arizona, but we want folks to be aware of it, as some of us have reached throughout the state. So James, if you want to just highlight that.
Yeah, absolutely. Thanks, Christina. So what C3 stands for is it stands for Community Consensus Collaborative. So try saying that 3 times really fast. That's so easy. C3 is a lot easier. But what it is it's an initiative that we want to take on primarily in Southern Arizona, but everyone is welcome, related to addressing issues of stigma, and also looking at actually value-based purchasing in the way that we look at outcomes and we pay for services and all of those kinds of things. The way that came about is when we were looking at our REBA RFP, those were the 2 most consistent messages that we had from peers, from providers, from the community in general, was really that discussion around stigma and how we address it, as well as the way that we look at it from a purchasing standpoint with value-based purchasing and those kinds of things. So it's on April 26th, the 9 to 2, I believe, and I'll put in the chat my email address, so if anyone wants to attend. I think, Dan, I know that you've been invited. Kathy, I believe you're invited. Christina certainly invited, but if others want to attend, it's really bringing together all the stakeholders. And when I say all the stakeholders, that's peer, family members, justice-involved individuals, as well as things like universities and community college, to really see, how we can continue to, include a variety of peers, elected officials, et cetera, so on and so forth, to really come up with actions. Our goal is to basically identify actions that we can all take to address stigma, and actions that we can take to look at the way we continue to look at value-based purchasing and payment of services. So I will put my email and address in the chat if anybody would like to attend. Again, it is in Tucson, so I know a lot of you probably live in northern Arizona, and it might be kind of a trip down to Tucson to be able to do that, but would love for you to attend if you're available. So thank you, Christina.
Thank you, James. Cappy, any closing thoughts?
No, I just thank you, James, for kind of role modeling to the other plans, you know, what needs to happen. And you definitely have done that. So thank you. And thank all the speakers. You guys did a great job.
And Christina, if I could just give a shout out for the Friday newsletter from OIFA. That's where you'll find where community events across the state, any of the OIFA offices, if we're holding events, if you're holding ones yourselves, you can share that with Chaz and it'll be in the Friday newsletter. So please check that out. It's on the Access website, Access OIFA.
Deb, I'm even going to put that in the chat here for folks.
Cool,
They want
thank you.
to sign up for the newsletter. You can sign up for the OIFA newsletter that way.
And
And
Christina, I don't know if you, for Shannon or Suzanne, if you could get the contact for NASCAR for Prescott to give to her in the chat.
yes. Yes, I could do that. And we also have a mental health day at the Capitol coming up May 1st. We should have mentioned that probably in the beginning. Very exciting event. There's about 10 different advocacy organizations and providers coming together to make this event happen. So if you're interested in participating that day, you can register in the link here. And just in case I don't get the NASCAR link here in time, I will also email it to you, Suzanne, so you have it.
Okay. Thank you.
Of course, thank you. Lori, anything else?
I think that's it.
Thank you for the opportunity to be a part of this panel. I really do appreciate it.
Thank you everyone for being here.
Thank you, Christina. We'll see you Thursday.
All right, see you Thursday. Bye-bye. All right, Suzanne, there's the link for NASCAR. And I'll also send it to you in an email.
Thank you. That's really helpful. I have a
I'll
bunch
send you the conversations. So you have all these resources in the chat.
Okay, I was afraid the conversation would go away, so I've been like writing frantically.
Yes,
Thank you.
okay. So I'm gonna stop the recording now and I will send all those contacts to you so you have them.
I appreciate it. Thank you.